Hey, Alphaness is Licensure from alphanessguy.com. This is 105 practice questions. Without the way, let's get started.
A child who has reddened eyes with no discharge, red, swollen, and peeling palms and soles of the feet, dry, cracked lips, and a strawberry tongue most likely has blank. The correct answer is 1. Kawasaki disease. Classic signs of Kawasaki disease include red eyes with no discharge, dry, cracked lips, strawberry tongue, and red, swollen, and peeling palms and soles of the feet. Incidence of Kawasaki disease is higher in males. The strongest indicator for this disease is the hallmark strawberry tongue. What can an electrocardiogram detect? Select all that apply. 1. Ischemia. 2. Injury. 3. Cardiac output. 4. Dysrhythmias. 5. Systemic vascular resistance. 6. Occlusion pressure. 7. Conduction delay. The correct answers are 1. Ischemia. 2. Injury. 4. Dysrhythmias. 7. Conduction delay. An electrocardiogram can indicate ischemia of the heart muscle. An electrocardiogram can indicate injury to the heart muscle. An electrocardiogram can show dysrhythmias. An electrocardiogram does show conduction delays. An electrocardiogram does not indicate cardiac output. An electrocardiogram does not show systemic vascular resistance. An electrocardiogram does not show occlusion pressures. The electrocardiogram checks the electrical system of the heart, not the mechanical system. Cardiac output is mechanical. Occlusion pressure does not have to do with the electrocardiogram, and systemic vascular resistance measures pressures in the peripheral system. The nurse is admitting a client with a diagnosis of rule-out Hodgkin's lymphoma. Which assessment data support this diagnosis? 1. Night sweats and fever without chills. 2. Edematous lymph nodes in the groin. 3. Malaise and complaints of an upset stomach. 4. Pain in the neck area after a fatty meal. The correct answer is 1. Night sweats and fever without chills. Clients with Hodgkin's disease experience drenching diaphoresis, especially at night, fever without chills, and unintentional weight loss. Early-stage disease is indicated by a painless enlargement of a lymph node on one side of the neck. Pruritus is also a common symptom. Malaise and stomach complaints are not associated with Hodgkin's disease. Pain in the neck area at the site of the cancer occurs in some clients after the ingestion of alcohol. The cause for this is unknown. The nurse is caring for clients in an oncology unit. Which neutropenia precautions should be implemented? 1. Hold all venipuncture sites for at least 5 minutes. 2. Limit fresh fruits and flowers. 3. Place all clients in reverse isolation. 4. Have the clients use a soft bristle toothbrush. The correct answer is 2. Limit fresh fruits and flowers. Fresh fruits and flowers may carry bacteria or insects on the skin of the fruit or dirt on the flowers and leaves, so they are restricted around clients with low white blood cell counts. Option 1 would be done for thrombocytopenia, not neutropenia. Clients with severe neutropenia may be placed in reverse isolation, but not all clients with neutropenia will be placed in reverse isolation. Clients are at a greater risk for infecting themselves from endogenous fungi and bacteria than from being exposed to non-infectious individuals. Option 4 is an intervention for thrombocytopenia. Option 3 has the word all in it, which would make you not select this option. A newborn is diagnosed with a congenital heart defect. The test results reveal that the lumen of the duct between the aorta and pulmonary artery remains open. This defect is known as blank. The correct answer is patent ductus arteriosus. This is a defect with increased pulmonary flow. It should close in the first few weeks of life. The client asks the nurse, "They say I have cancer. How can they tell if I have Hodgkin's disease from a biopsy?" The nurse's answer is based on which scientific rationale? 1. Biopsies are nuclear medicine scans that can detect cancer. 2. A biopsy is a laboratory test that detects cancer cells. 3. It determines which kind of cancer the client has. 4. The HCP takes a small piece out of the tumor and looks at the cells. The correct answer is 4. The HCP takes a small piece out of the tumor and looks at the cells. A biopsy is the removal of cells from a mass and examination of the tissue under a microscope to determine if the cells are cancerous. Reed-Sternberg cells are diagnostic for Hodgkin's disease. If these cells are not found in the biopsy, the HCP can rebiopsy to make sure the specimen provided the needed sample, or, depending on involvement of the tissue, diagnose a non-Hodgkin's lymphoma. Biopsies are surgical procedures requiring needle aspiration or excision of the area. They are not nuclear medicine scans. The biopsy specimen is sent to the pathology laboratory for the pathologist to determine the type of cell. Laboratory test refers to tests of body fluids performed by a laboratory technician. A biopsy is used to determine if the client has cancer, and if so, what kind. However, this response does not answer the client's question. Option 1 can be eliminated if you know what the word biopsy means. Option 3 does not answer the question and can be eliminated for this reason. Tetralogy of Fallot involves which defects? Select all that apply. 1. Ventricular septal defect. 2. Right ventricular hypertrophy. 3. Left ventricular hypertrophy. 4. Pulmonic stenosis. 5. Pulmonic atresia. 6. Overriding aorta. 7. Patent ductus arteriosus. The correct answers are 1. Ventricular septal defect. 2. Right ventricular hypertrophy. 4. Pulmonic stenosis. And 6. Overriding aorta. Tetralogy of Fallot is a congenital defect with a ventricular septal defect, right ventricular hypertrophy, pulmonary valve stenosis, and overriding aorta. Pulmonary stenosis causes decreased pulmonary flow. The client diagnosed with non-Hodgkin's lymphoma is scheduled for a lymphangiogram. Which information should the nurse teach? 1. The scan will identify any malignancy in the vascular system. 2. Radiopaque dye will be injected between the toes. 3. The test will be done similar to a cardiac angiogram. 4. The test will be completed in about 5 minutes. The correct answer is 2. Radiopaque dye will be injected between the toes. Dye is injected between the toes of both feet, and then scans are performed in a few hours, at 24 hours, and then possibly once a day for several days. In option 1, the scan detects abnormalities in the lymphatic system, not the vascular system. Cardiac angiograms are performed through the femoral or brachial arteries and are completed in one session. The test takes 30 minutes to 1 hour and then is repeated at intervals. Options 1 and 3 could be eliminated because of the words vascular and cardiac. These words pertain to the cardiovascular system, not the lymphatic system. A 10-year-old child is recovering from a severe sore throat. The parent states that the child complains of chest pain. The nurse observes that the child has swollen joints, nodules on the fingers, and a rash on the chest. The likely cause is blank. The correct answer is rheumatic fever. To make the diagnosis of rheumatic fever, major and minor criteria are used. Major criteria include carditis, subcutaneous nodules, erythema marginatum, chorea, and arthritis. Minor criteria include fever and previous history of rheumatic fever. Rheumatic fever is an inflammatory disease caused by group A beta hemolytic streptococcus. The nurse is caring for a client diagnosed with acute myeloid leukemia. Which assessment data warrant immediate intervention? 1. Temperature 99.0 degrees Fahrenheit, pulse 102, respirations 22, and blood pressure 132/68. 2. Hyperplasia of the gums. 3. Weakness and fatigue. 4. Pain in the left upper quadrant. The correct answer is 4. Pain in the left upper quadrant. Pain is expected, but it is a priority, and pain control measures should be implemented. The vital signs in option 1 are not alarming. The vital signs are slightly elevated and indicate monitoring at intervals, but they do not indicate an immediate need. Hyperplasia of the gums is a symptom of myeloid leukemia, but it is not an emergency. Weakness and fatigue are symptoms of the disease and are expected. If all the answer options contain expected events, you must decide which is priority, and pain is a priority need. What should the nurse assess prior to administering digoxin? 1. Sclera. 2. apical pulse rate. 3. Cough. 4. Liver function test. The correct answer is 2. Apical pulse rate. The apical pulse rate is assessed because digoxin decreases the heart rate. If the heart rate is less than 60 beats per minute, digoxin should not be administered. The sclera has nothing to do with congestive heart failure. Cough would not be assessed before administration. It is more commonly seen in patients who have been prescribed ACE inhibitors. Liver function tests are not assessed before digoxin is administered. Digoxin can lower the heart rate and cause dysrhythmias. The nurse is completing a care plan for a client diagnosed with leukemia. Which independent problem should be addressed? 1. Infection. 2. Anemia. 3. Nutrition. 4. Grieving. The correct answer is 4. Grieving. Grieving is an independent problem, and the nurse can assess and treat this problem with or without collaboration. Treating infections, which require HCP orders for cultures and antibiotics, is a collaborative problem. The treatment of anemia is a collaborative problem. The provision of adequate nutrition requires collaboration between the nurse, HCP, and dietitian. The stem of the question asks for an independent intervention. If you understand the problem and the treatment needs, options 1, 2, and 3 can be eliminated. Which statement by a parent of an infant with congestive heart failure who is being sent home on digoxin indicates the need for further education? 1. I will give the medication at regular 12-hour intervals. 2. If he vomits, I will not give a makeup dose. 3. If I miss a dose, I will not give an extra dose. 4. I will mix the digoxin in some formula to make it taste better. The correct answer is 4. I will mix the digoxin in some formula to make it taste better. If the medication is mixed in his formula and he refuses to drink the entire amount, the dose will be inadequate. Options 1, 2, and 3 are appropriate for digoxin administration. The charge nurse and the licensed practical nurse are caring for clients on an oncology floor. Which client should not be assigned to the LPN? 1. The client newly diagnosed with chronic lymphocytic leukemia. 2. The client who is 4 hours post-procedure bone marrow biopsy. 3. The client who received 2 units of PRBCs on the previous shift. 4. The client who is receiving multiple intravenous piggyback medications. The correct answer is 1. The client newly diagnosed with chronic lymphocytic leukemia. The newly diagnosed client will need to be taught about the disease and about treatment options. The charge nurse cannot delegate teaching to an LPN. For option 2, this client is post-procedure and could be cared for by the LPN. For option 3, this client has already received the blood products. This client requires routine monitoring, which the LPN could perform. For option 4, the LPN can administer antibiotic medications. Which finding might delay a cardiac catheterization procedure on a 1-year-old? 1. 30th percentile for weight. 2. Severe diaper rash. 3. Allergy to soy. 4. Oxygen saturation of 91% on room air. The correct answer is 2. Severe diaper rash. A child with severe diaper rash has potential for infection if the interventionist makes the standard groin approach. Option 1 and 4 may be a reason the child needs catheterization. Shellfish, not soy, is an allergy concern. The nurse writes a nursing problem of altered nutrition for a client diagnosed with leukemia who has received a treatment regimen of chemotherapy and radiation. Which nursing intervention should be implemented? 1. Administer an antidiarrheal medication prior to meals. 2. Monitor the client's serum albumin levels. 3. Assess for signs and symptoms of infection. 4. Provide skincare to irradiated areas. The correct answer is 2. Monitor the client's serum albumin levels. Serum albumin is a measure of the protein content in the blood that is derived from the foods eaten. Albumin monitors nutritional status. The nurse should administer an antiemetic prior to meals, not an antidiarrheal medication. Assessment of the nutritional status is indicated for this problem, not assessment of the signs and symptoms of infections. This addresses an altered skin integrity problem. The nurse is caring for a child who has undergone a cardiac catheterization. During recovery, the nurse notices the dressing is saturated with bright red blood. The nurse's first action is to 1. Call the interventional cardiologist. 2. Notify the cardiac catheterization laboratory that the child will be returning. 3. Apply a bulky pressure dressing over the present dressing. 4. Apply direct pressure 1 inch above the puncture site. The correct answer is 4. Apply direct pressure 1 inch above the puncture site. Applying direct pressure 1 inch above the puncture site will localize pressure over the vessel site. Options 1 and 2 are not appropriate actions. Option 3 can be done after applying direct pressure 1 inch above the puncture site. The laboratory results for a male client diagnosed with leukemia include RBC count 2.1 times 10 to the power of 6 cubic millimeter, WBC count 150 times 10 to the power of 3 cubic millimeter, platelets 22 times 10 to the power of 3 cubic millimeter, potassium 3.8 milliequivalents per liter, and sodium 139 milliequivalents per liter. Based on these results, which intervention should the nurse teach the client? 1. Encourage the client to eat foods high in iron. 2. Instruct the client to use an electric razor when shaving. 3. Discuss the importance of limiting sodium in the diet. 4. Instruct the family to limit visits to once a week. The correct answer is 2. Instruct the client to use an electric razor when shaving. The platelet count of 22 times 10 to the power of 3 cubic millimeter indicates a platelet count of 22,000. The definition of thrombocytopenia is a count less than 100,000. This client is at risk for bleeding. Bleeding precautions include decreasing the risk by using soft bristle toothbrushes and electric razors and holding all venipuncture sites for a minimum of 5 minutes. The anemia that occurs in leukemia is not related to iron deficiency, and eating foods high in iron will not help. The sodium level is within normal limits. The client is encouraged to eat whatever he or she wants to eat unless some other disease process limits food choices. The client is at risk for infection, but unless the family or significant others are ill, they should be encouraged to visit whenever possible. You could eliminate option 3 on the basis of a normal laboratory value. The RBC, WBC, and platelet values are all not in normal range. The correct answer option must address one of these values. Which interventions decrease cardiac demands in an infant with congestive heart failure? Select all that apply. 1. Allow parents to hold and rock their child. 2. Feed only when the infant is crying. 3. Keep the child uncovered to promote low body temperature. 4. Make frequent position changes. 5. Feed the child when sucking the fists. 6. Change bed linens only when necessary. 7. Organize nursing activities. The correct answers are 1. Allow parents to hold and rock their child. 4. Make frequent position changes. 5. Feed the child when sucking the fists. 6. Change bed linens only when necessary. And 7. Organize nursing activities. Rocking by the parents will comfort the infant and decrease demands. Frequent position changes will decrease the risk for infection by avoiding immobility with its potential for skin breakdown. An infant sucking the fists could indicate hunger. Change bed linens only when necessary to avoid disturbing the child. Organize nursing activities to avoid disturbing the child. The infant would not be fed when crying because crying increases cardiac demands. The infant might choke if the nipple is placed in the mouth and the child inhales when trying to swallow. Keep the child normothermic to reduce metabolic demands. Which medication is contraindicated for a client diagnosed with leukemia? 1. Bactrim, a sulfa antibiotic. 2. Morphine, a narcotic analgesic. 3. Epigen, a biologic response modifier. 4. Gleevec, a genetic blocking agent. The correct answer is 3. Epigen, a biologic response modifier. Epigen is a biologic response modifier that stimulates the bone marrow to produce red blood cells. The bone marrow is the area of malignancy in leukemia. Stimulating the bone marrow would be generally ineffective for the desired results, and would have the potential to stimulate malignant growth. Because of the ineffective or non-existent WBC's characteristic of leukemia, the body cannot fight infections, and antibiotics are given to treat infections. Leukemic infiltrations into the organs or the central nervous system cause pain. Morphine is the drug of choice for most clients with cancer. Gleevec is a drug that specifically works in leukemic cells to block the expression of the BCR-ABL protein, preventing the cells from growing and dividing. If you were not familiar with the drug mentioned in option 4, then this option would not be a good choice. Options 1 and 2 are common drugs and should not be chosen as the answer unless you know for sure they are contraindicated. Indomethacin may be given to close which congenital heart defect in newborns? Blank. The correct answer is patent ductus arteriosus. Prostaglandins allow the duct to remain open. Thus, a prostaglandin inhibitor, such as indomethacin or ibuprofen, can help close the duct. The client diagnosed with leukemia is being admitted for an induction course of chemotherapy. Which laboratory values indicate a diagnosis of leukemia? 1. A left shift in the white blood cell count differential. 2. A large number of WBCs that decreases after the administration of antibiotics. 3. An abnormally low hemoglobin and hematocrit level. 4. Red blood cells that are larger than normal. The correct answer is 1. A left shift in the white blood cell count differential. A left shift indicates immature white blood cells are being produced and released into the circulating blood volume. This should be investigated for the malignant process of leukemia. Leukocytosis is normal in the presence of an infection, but it should decrease as the infection clears. A low hemoglobin and hematocrit level indicates anemia and can be caused by a number of factors. Anemia does occur in leukemia, but it is not diagnostic for leukemia. Red blood cells larger than normal occur in macrocytic anemias. They are not characteristic of leukemia. You should recognize elevated WBCs resolve with antibiotics as an infection. Option 3 is not specific enough to be the correct answer. For the child with hypoplastic left heart syndrome, which drug may be given to allow the patent ductus arteriosus to remain open until surgery? Blank. The correct answer is prostaglandin E. Prostaglandin E maintains ductal patency to promote blood flow until the Norwood procedure is begun. Consider the opposite of wanting to close the patent ductus arteriosus. The client is diagnosed with chronic lymphocytic leukemia after routine laboratory tests during a yearly physical. Which is the scientific rationale for the random nature of discovering the illness? 1. CCL is not serious, and clients die from other causes first. 2. There are no symptoms with this form of leukemia. 3. This is a childhood illness and is self-limiting. 4. In the early stages of chronic lymphocytic leukemia, the client may be asymptomatic. The correct answer is 4. In the early stages of chronic lymphocytic leukemia, the client may be asymptomatic. In this form of leukemia, the cells seem to escape apoptosis, which results in many thousands of mature cells clogging the body. Because the cells are mature, the client may be asymptomatic in the early stages. All types of leukemia are serious and can cause death. The chronic types of leukemia are more insidious in the onset of symptoms and can have a slower progression of the disease. Chronic types of leukemia are more common in the adult population. The symptoms may have a slower onset, but anemia causing fatigue and weakness and thrombocytopenia causing bleeding can be present. Organ enlargement from infiltration may be present. Secondary symptoms of fever, night sweats, and weight loss may also be present. On examination, a nurse hears a murmur at the left sternal border in a child with diarrhea and fever. The parent asks why the healthcare provider never said anything about the murmur. The nurse explains. 1. The healthcare provider is not a cardiologist. 2. Murmurs are difficult to detect, especially in children. 3. The fever increased the intensity of the murmur. 4. We need to refer the child to an interventional cardiologist. The correct answer is 3. The fever increased the intensity of the murmur. The increased CO of the fever increases the intensity of the murmur, making it easier to hear. Option 1 is not a therapeutic response. This child does not need to see an interventional cardiologist. The murmur needs to be diagnosed first, and then a treatment plan would be developed. The client diagnosed with leukemia is scheduled for bone marrow transplantation. Which interventions should be implemented to prepare the client for this procedure? Select all that apply. 1. Administer high-dose chemotherapy. 2. Teach the client about autologous transfusions. 3. Have the family members human leukocyte antigen typed. 4. Monitor the complete blood cell count daily. 5. Provide central line care per protocol. The correct answers are 1. Administer high-dose chemotherapy. 3. Have the family members human leukocyte antigen typed. 4. Monitor the complete blood cell count daily. And 5. Provide central line care per protocol. All of the bone marrow cells must be destroyed prior to implanting the healthy bone marrow. High-dose chemotherapy and full-body irradiation therapy are used to accomplish this. The best bone marrow donor comes from an identical twin. Next best comes from a sibling who matches. The most complications occur from a matched unrelated donor. The client's body recognizes the marrow as foreign and tries to reject it, resulting in graft versus host disease. The CBC must be monitored daily to assess for infections, anemia, and thrombocytopenia. Clients will have at least one multiple-line central venous access. These clients are seriously ill and require multiple transfusions and antibiotics. Autologous transfusions are infusions from the client himself or herself. This client has cancer involving blood tissue. To reinfuse the client's own tissues would be to purposefully give the client cancer cells. While assessing a newborn with respiratory distress, the nurse auscultates a machine-like heart murmur. Other findings are a wide pulse pressure, periods of apnea, increased PaCO2, and decreased PO2. The nurse suspects that the newborn has 1. Pulmonary hypertension. 2. Patent ductus arteriosus. 3. Ventricular septal defect. 4. Bronchopulmonary dysplasia. The correct answer is 2. Patent ductus arteriosus. The main identifier is the machine-like murmur, which is the hallmark of a patent ductus arteriosus. Pulmonary hypertension is a pulmonary condition which does not create a heart murmur. A ventricular septal defect does not produce a machine-like murmur. Bronchopulmonary dysplasia is a pulmonary condition which does not create a heart murmur. The client diagnosed with leukemia has central nervous system involvement. Which instruction should the nurse teach? 1. Sleep with the head of the bed elevated to prevent increased intracranial pressure. 2. Take analgesic medication for pain only when the pain becomes severe. 3. Explain radiation therapy to the head may result in permanent hair loss. 4. Discuss end-of-life decisions prior to cognitive deterioration. The correct answer is 3. Explain radiation therapy to the head may result in permanent hair loss. Radiation therapy to the head and scalp area is the treatment of choice for central nervous system involvement of any cancer. Radiation therapy has longer-lasting side effects than chemotherapy. If the radiation therapy destroys the hair follicles, the hair will not grow back. Sleeping with the head of the bed elevated might relieve some intracranial pressure, but it will not prevent increased intracranial pressure from occurring. Analgesic medications for clients with cancer are given on a scheduled basis with a fast-acting analgesic administered PRN for breakthrough pain. Cognitive deterioration does not usually occur. You must be aware of the treatments used for the disease processes to answer this question, but might eliminate option 2 because it violates basic principles of pain management. Which are the most serious complications for a child with Kawasaki disease? Select all that apply. 1. Coronary thrombosis. 2. Coronary stenosis. 3. Coronary artery aneurysm. 4. Hypocoagulability. 5. Decreased sedimentation rate. 6. Hypoplastic left heart syndrome. The correct answers are 1. Coronary thrombosis, 2. Coronary stenosis, and 3. Coronary artery aneurysm. Thrombosis, stenosis, and aneurysm affect blood vessels. The child with Kawasaki disease has hypercoagulability and an increased sedimentation rate due to inflammation. Hypoplastic left heart syndrome is a congenital heart defect and has no relation to Kawasaki disease. The nurse is assessing a client diagnosed with acute myeloid leukemia. Which assessment data support this diagnosis? 1. Fever and infections. 2. Nausea and vomiting. 3. Excessive energy and high platelet counts. 4. Cervical lymph node enlargement and positive acid-fast bacillus. The correct answer is 1. Fever and infections. Fever and infection are hallmark symptoms of leukemia. They occur because the bone marrow is unable to produce white blood cells of the number and maturity needed to fight infection. Nausea and vomiting are symptoms related to the treatment of cancer, but not to the diagnosis of leukemia. The clients are frequently fatigued and have low platelet counts. The platelet count is low as a result of the inability of the bone marrow to produce the needed cells. In some forms of leukemia, the bone marrow is not producing cells at all, and in others, the bone marrow is stuck producing tens of thousands of immature cells. Cervical lymph node enlargement is associated with Hodgkin's lymphoma, and positive acid-fast bacillus is diagnostic for tuberculosis. Option 3 could be eliminated right off the bat because of the excessive energy. Illness normally drains energy reserves. It does not increase them. At 9 o'clock, the charge nurse observes the primary nurse crushing an enteric-coated aspirin in the medication room. Which action should the charge nurse implement? 1. Take no action because this is an acceptable standard of practice. 2. Correct the primary nurse's behavior in the medication room. 3. Explain that enteric-coated medication should not be crushed. 4. Complete an adverse occurrence report on the primary nurse. The correct answer is 3. Explain that enteric-coated medication should not be crushed. The charge nurse should explain to the primary nurse that enteric-coated aspirin should not be crushed because the coating ensures the aspirin will dissolve only in the small intestine where the coating dissolves. The aspirin will be absorbed in the stomach if the coating is crushed. Enteric-coated aspirin should not be crushed. The charge nurse should not correct the primary nurse in front of other staff, and, at 9 o'clock, there would be other nurses in the medication room. Because the client did not receive the crushed enteric-coated aspirin, no adverse occurrence report needs to be completed. This form is completed if the client's condition has been compromised in some way. The client is diagnosed with low back pain and is prescribed cyclobenzaprine. Which instructions should the clinic nurse teach the client? Select all that apply. 1. Take the medication just before leaving home for work each day. 2. Drink a full glass of water with each dose of medication. 3. The medication can cause drowsiness that will make driving unsafe. 4. Divide the dose of medication between early morning and bedtime. 5. Suck on hard candy if you experience a dry mouth. The correct answers are 3. The medication can cause drowsiness that will make driving unsafe, and 5. Suck on hard candy if you experience a dry mouth. Cyclobenzaprine is a muscle relaxant. The medication acts on the central nervous system and can cause drowsiness. The client should be warned not to drive until the client understands the effects on his or her body. Driving could be dangerous for the client and others. Taking the medication before leaving the house could be a danger to the client and others because this medication can cause drowsiness. The client should not be driving or operating equipment until the client has determined the effect of the medication on his or her body. There is no need to drink a full glass of water when taking cyclobenzaprine. A side effect of cyclobenzaprine is a dry mouth, so using hard candy is an appropriate intervention. The client diagnosed with a partial thickness burn is prescribed mafenide acetate. Which intervention should the emergency department nurse implement when applying this medication? 1. Do not administer if the serum sodium level is decreased. 2. Assess the client's urine for any increased concentration. 3. Determine the amount of burned skin using the rule of 9. 4. Pre-medicate the client prior to administering the medication. The correct answer is 4. Pre-medicate the client prior to administering the medication. Mafenide acetate is a topical antimicrobial. The medication causes pain or a burning sensation following its application. Therefore, the client should be pre-medicated. The serum sodium level is not affected by mafenide acetate, a topical antimicrobial. It is affected when administering silver nitrate, a topical antimicrobial that is also used to treat burns. Urine concentration may be affected by silver sulfadiazine, a topical antimicrobial that is used to treat burns, but mafenide acetate does not affect urine concentration. This should have been done prior to the emergency department's physician prescribing this medication. Therefore, this would not be an appropriate intervention. The client diagnosed with a stage 2 pressure ulcer is prescribed a hydrogel dressing. Which statement indicates the client understands the teaching about the hydrogel dressing? 1. The hydrogel dressing is soothing and reduces pain. 2. It must be used because my pressure ulcer drains a lot. 3. This dressing can only be used if my wound is not infected. 4. This dressing is very difficult to apply and remove from the wound. The correct answer is 1. The hydrogel dressing is soothing and reduces pain. Hydrogels help maintain a moist healing environment, granulation, and epithelialization, and they facilitate autolytic debridement. One advantage of a hydrogel dressing is that it is soothing and reduces pain. One of the disadvantages of hydrogel dressings is that they are not recommended for wounds with heavy exudate. An advantage of using hydrogel dressings is that they can be used when infection is present. An advantage of using hydrogel dressings is that they are easily applied and removed from the wound. The charge nurse on an orthopedic unit is transcribing orders for a client diagnosed with back pain. Which HCP order should the charge nurse question? 1. Physical therapy for hot packs and massage. 2. Complete blood count and complete metabolic panel. 3. Hydrocodone PRN. 4. Carisoprodol POBID. The correct answer is 3. Hydrocodone PRN. Hydrocodone is an opioid analgesic. This medication order is incomplete. The nurse should contact the HCP for a time limitation. Physical therapy for heat and massage is standard therapy for back pain. There is no reason to question this order. For option 2, many medications can affect the kidneys or the liver and the blood counts. Baseline data should be obtained. There is no reason to question this order. Carisoprodol is a muscle relaxant and comes in one strength, so this order is complete. There is no reason to question this order. The nurse is caring for a client diagnosed with a stage 3 pressure ulcer. The client has a Combiderm non-adhesive, sterile, hydrocolloidal dressing. Which data indicates the dressing is ready to be removed? 1. The exudate begins to pool on the wound surface. 2. The color of the drainage changes from brown to a yellow-gray. 3. The HCP must write an order to remove the dressing. 4. The softened area is approaching the edge of the dressing. The correct answer is 4. The softened area is approaching the edge of the dressing. This dressing is an absorbent hydrocolloidal dressing that provides a moist environment, absorbs exudates, and is non-damaging to the skin. When the softened area approaches the edge of the dressing, it must be removed, and a new one must be applied. Option 1 would indicate when an alginate dressing, not a hydrocolloidal dressing, is ready to be removed. The iodosorb gel, not the Combiderm dressing, should be changed when the color changes from brown to a yellow-gray. The nurse does not need a written order from the HCP to change the dressing. The nurse is administering medications to clients on an orthopedic unit. Which medication should the nurse question? 1. Ibuprofen to a client diagnosed with back pain and a history of ulcers. 2. Morphine to a client diagnosed with back pain rated as 6. 3. Methocarbamol to a client diagnosed with chronic back pain. 4. Acetaminophen with codeine 3 to a client diagnosed with mild back pain. The correct answer is 1. Ibuprofen to a client diagnosed with back pain and a history of ulcers. Ibuprofen is an NSAID. NSAIDs decrease prostaglandin production in the stomach, increasing the client's risk of developing ulcers. This client has a known risk of peptic ulcer disease. The nurse should question the medication and discuss this with the HCP. Morphine sulfate is an opioid analgesic. Opioid analgesics are administered for pain. The client is in the moderate to severe pain range. The nurse would administer this medication. Methocarbamol is a muscle relaxant. Muscle relaxant medications are administered to clients with back pain to relax the muscles and decrease the pain. The nurse would administer this medication. Acetaminophen is a non-narcotic analgesic, and when combined with codeine, a narcotic analgesic, the potency of medication for pain relief is increased. The nurse would administer this medication. The nurse is changing a hydrocolloid antimicrobial barrier dressing with silver for a client diagnosed with a stage 4 pressure ulcer. Which intervention should the nurse implement first? 1. Rinse the wound with physiologically normal saline. 2. Remove the old dressing and assess the pressure ulcer. 3. Hold the dressing in place for 5 seconds after applying. 4. Apply sterile gloves when performing the procedure. The correct answer is 2. Remove the old dressing and assess the pressure ulcer. Removing the old dressing and assessing the pressure ulcer for healing is the first intervention. The nurse should rinse the wound with physiologically normal saline, but this is not the first intervention. This dressing must be held in place for 5 seconds after applying it to the pressure ulcer. The dressing change is performed with non-sterile gloves using aseptic technique. Therefore, this is not an appropriate intervention. The client diagnosed with low back pain is prescribed morphine sulfate. Which interventions should the nurse implement? Select all that apply. 1. Discuss with the HCP starting the client on a stool softener. 2. Teach the client about rating the pain on a numeric pain scale. 3. Inform the client to rise quickly from a supine position. 4. Administer anticonvulsant medications around the clock. 5. Tell the client to call for assistance when getting out of bed. The correct answers are 1. Discuss with the HCP, starting the client on a stool softener. 2. Teach the client about rating the pain on a numeric pain scale. And 5. Tell the client to call for assistance when getting out of bed. Narcotic pain medications slow peristalsis in the small and large intestines, increasing the risk for constipation and fecal impaction. The nurse should discuss a bowel regimen with the HCP. The nurse should attempt to have the client quantify the pain so that the effectiveness of interventions can be evaluated. The numeric pain scale is one method of objectifying the pain. Rising quickly from a flat on the back position could increase the client's pain. Some of the medications administered for back pain can cause orthostatic hypotension. The nurse should teach the client to turn on the side and push up on the elbow slowly when getting out of bed. The client may be taking antispasmodic and pain medications, but there is no reason for anticonvulsant medications. For option 5, tell the client to call for assistance when getting out of bed. The male client diagnosed with a stage 4 pressure ulcer on the coccyx area is being treated with an autolytic medication for debridement and an occlusive dressing. The wife of the client asks the nurse, "Why isn't someone doing something about that foul odor my husband has?" Which statement is the nurse's best response? 1. I will contact your husband's doctor when he makes rounds. 2. The odor is secondary to an infection, and he is taking antibiotics. 3. The odor is an expected reaction to the pressure dressing. 4. I am sorry the odor bothers you. We will bathe your husband. The correct answer is 3. The odor is an expected reaction to the pressure dressing. Option 3 is an expected reaction to the pressure dressing. The foul odor is produced by the breakdown of cellular debris and does not indicate that the wound is infected. In option 1, there is no reason to contact the HCP because this is an expected reaction to the pressure dressing. In option 2, the client may have an infection and is taking antibiotics, but this is not causing the foul odor. In option 4, bathing the husband will not help the odor. Therefore, this response is not appropriate. The client diagnosed with low back pain is scheduled to have a steroid injection into the intrathecal space. Which statement by the client indicates the client understands the procedure? 1. I will have to curl up like a Halloween cat. 2. This procedure will cure my back pain. 3. I will have an injection in each of my hips. 4. There is no risk with this procedure. The correct answer is 1. I will have to curl up like a Halloween cat. Intrathecal indicates into the central nervous system via a lumbar puncture. The client will be positioned with the back arched, much like a Halloween cat, for the HCP to be able to insert the needle between the vertebrae. The procedure provides temporary relief of inflammation of affected nerves. The injections are into the intravertebral space, not into the hips. An injection in the hips indicates an intramuscular injection. There is risk with any procedure. In this procedure, nerve damage is the greatest risk. The nurse is using the antimicrobial binding dressing, Actisorb Silver 220, for a stage 3 pressure ulcer on the left hip area. The dressing is a combination of silver and activated charcoal. Which intervention should the nurse implement? 1. Perform the sterile dressing change twice a day. 2. Avoid cutting the dressing when applying it to the wound. 3. Pre-medicate the client with a narcotic analgesic. 4. Do not use tape to hold the secondary dressing in place. The correct answer is 2. Avoid cutting the dressing when applying it to the wound. The nurse should avoid cutting the dressing because particles of activated charcoal may get into the wound and cause discoloration. The dressing may be left in place for up to 7 days or may be changed every 24 hours, but it would not be changed twice a day. This does not allow the dressing adequate time to increase healing of the wound. The dressing change does not warrant administering a narcotic analgesic to the client. Tape should be used to hold the secondary dressing in place, or the antimicrobial binding dressing will not remain in the pressure ulcer. The nurse is completing the preoperative checklist for a client diagnosed with a herniated disc. Which information is a priority for the nurse to notify the operating room staff? 1. The client is reporting a headache. 2. The client is allergic to iodine and aspirin. 3. The client has not had anything to drink. 4. The client's hematocrit is 43%. The correct answer is 2. The client is allergic to iodine and aspirin. The standard surgical scrub is a povidone iodine antiseptic skin preparation. This should be brought to the attention of the surgical nurse who will be preparing the surgical site so that a substitute can be used. The client's report of a headache occurs frequently when clients have not been able to eat or drink, especially caffeine drinks. This is not a priority at this time. Clients going to surgery should be NPO for several hours to prevent aspiration during anesthesia. Option 4 is a normal hematocrit level. The client is prescribed silver sulfadiazine for a partial thickness burn to the back. Which information should the nurse discuss concerning this medication? 1. Encourage the client to drink 3,000 milliliters of water. 2. Discuss the need to eat foods high in protein. 3. Teach the client how to test the urine for ketones. 4. Instruct the client to change the dressing twice a day. The correct answer is 1. Encourage the client to drink 3,000 milliliters of water. Silver sulfadiazine is a sulfonamide antibacterial agent. The client should drink large amounts of fluids to prevent sulfa crystals from forming in the urine. The client should eat foods high in protein for healing purposes, but this does not specifically concern this medication. Ketones are a byproduct of fat breakdown and would not be specific for teaching about silver sulfadiazine. The client should change the dressing twice a day, but this is not part of teaching about the medication silver sulfadiazine. The client presents to the outpatient clinic reporting back pain. Which assessment question should the nurse ask first? 1. What activity did you do to hurt your back? 2. Which over-the-counter medications have you taken? 3. Have you used illegal drugs to treat the back pain? 4. Did you miss any work time because of this pain? The correct answer is 2. Which over-the-counter medications have you taken? The priority at this time is to determine what medications have been tried in order to assess the full extent of the injury. This is the first intervention. Adult clients will frequently only seek the HCP's advice and treatment when remedies have failed. Option 1 is important, but it is not a priority during the initial assessment. The nurse should determine how the client has been treating the injury. This would be the second query, not the first. Option 3 is an accusatory statement and most likely will make the client mistrust the nurse's objectives. This should not be asked at this time. Option 4 is the third query the nurse could ask. Missed work time is important, but to treat the client, the HCP must be aware of the attempted treatments. The HCP prescribed morphine 2 to 5 milligrams intramuscular every 2 hours for the client diagnosed with full thickness, burns to the chest and abdominal area. The client reports pain of 10 on a pain scale from 1 through 10. Which intervention should the nurse implement? 1. Administer 5 milligrams of morphine IM to the client immediately. 2. Contact the HCP to request an increase in the medication. 3. Request a patient-controlled analgesia pump for the client. 4. Assess the client for complications and then administer the medication. The correct answer is 3. Request a patient-controlled analgesia pump for the client. The client should have IV pain medication until hemodynamic stability and unimpaired tissue perfusion return. The PCA pump provides an IV route, and the client can control the amount of medication administered with the PCA, ensuring safe limits of pain medication. The client should receive IV medication, not IM medication. Therefore, the nurse should not administer this medication after assessing the client. The nurse should be a client advocate and notify the HCP for a change in the route of the morphine. The client diagnosed with chronic low back pain has been taking baclofen. Which instruction should the nurse review with the client? 1. The medication can cause gastric ulcer formation. 2. The client may consume no more than 1 glass of wine per day. 3. The medication must be tapered off when discontinued. 4. The client should not take the medication before bedtime. The correct answer is 3. The medication must be tapered off when discontinued. Baclofen must be tapered off when being discontinued. Abrupt withdrawal after prolonged use can cause anxiety, agitated behavior, hallucinations, severe tachycardia, acute spasticity, and seizures. This medication is not known to increase the risk of ulcers. The client should be warned not to consume any alcohol while taking baclofen. Baclofen is a central nervous system depressant, as is alcohol. The combination of alcohol and baclofen could intensify the depressant effects. The medication can cause drowsiness, which might assist the client to rest. Administration at bedtime is preferred if this is the case. The client diagnosed with partial and full thickness, burns to 35% of the body, is admitted to the burn department. The HCP has prescribed famotidine. Which statement best describes the scientific rationale for administering this medication? 1. Famotidine acts on the cell wall to prevent bacterial growth. 2. Famotidine will help control the client's pain. 3. Famotidine will help decrease the client's nausea and vomiting. 4. Famotidine will help decrease gastric acid production. The correct answer is 4. Famotidine will help decrease gastric acid production. Curling's ulcer is an acute ulceration of the stomach or duodenum that forms following a burn injury. Histamine 2 antagonists like famotidine are administered to decrease gastric acid secretion in the acute phase of burn care. Silver sulfadiazine, a topical antimicrobial, not famotidine, acts on the cell membrane and cell wall of susceptible bacteria and binds to cellular DNA. IV opioid medications, not famotidine, will help decrease the client's pain. Antiemetics, not famotidine, will help prevent the client's nausea and vomiting. The nurse is administering 9 o'clock medications to clients on a medical unit. Which medication should be administered first? 1. Morphine sulfate extended release to a client with low back pain. 2. Chlorzoxazone to a client on bed rest. 3. Acetaminophen to a client with a headache. 4. Diazepam to a client with muscle spasms. The correct answer is 4. Diazepam to a client with muscle spasms. Diazepam is a benzodiazepine. A client having muscle spasms is a priority for the nurse. Muscle spasms can be extremely painful. This medication should be administered first. Morphine sulfate extended release is an opioid analgesic and is a sustained-release tablet. This medication is to provide relief of chronic pain over the course of the day. It does not need to be the first medication administered. Chlorzoxazone is a muscle relaxant. The client-prescribed bed rest usually takes a muscle relaxant as a routine medication. It does not need to be administered first. Acetaminophen is an analgesic. A headache that is to be treated with acetaminophen would not be the first medication for the nurse to administer. Which client should the nurse use caution with when applying mafenide acetate to a burned area? 1. A client with a creatinine level of 0.8 mg per deciliter. 2. A client diagnosed with chronic obstructive pulmonary disease. 3. A client with a pulse oximeter reading of 95%. 4. A client diagnosed with type 2 diabetes who is taking insulin. The correct answer is 2. A client diagnosed with chronic obstructive pulmonary disease. Mafenide acetate is a topical antimicrobial. Mafenide acetate impairs the renal mechanism involved in the buffering of the blood, thereby increasing the excretion of bicarbonate in the urine. When this occurs, the pulmonary system effects a compensatory hyperventilatory status to maintain normal acid-base balance. If this compensation cannot take place as a result of pulmonary disease, the client develops metabolic acidosis. Mafenide acetate affects the acid-base balance in the body and should not be administered to clients diagnosed with renal disease. A 0.8 mg per deciliter serum creatinine level is within normal range of 0.5 to 1.5 mg per deciliter. Therefore, the nurse would not need to use caution with this client. This client has adequate respiratory status. Therefore, the nurse would not need to use caution with this client. There is no reason a client diagnosed with diabetes could not be prescribed mafenide acetate. The client is admitted with severe low back pain and prescribed methocarbamol IV piggyback every 8 hours. Which nursing intervention has priority when administering this medication? 1. Ask the client to lie flat for 15 minutes following the IV infusion. 2. Infuse at a rapid rate of 200 to 250 milliliter per hour via an infusion pump. 3. Assess the IV site for extravasation after the infusion is complete. 4. Monitor liver function laboratory tests daily. The correct answer is 1. Ask the client to lie flat for 15 minutes following the IV infusion. Methocarbamol is a muscle relaxant. The client should be kept recumbent during and for at least 15 minutes following the administration of methocarbamol IV to reduce the risk of orthostatic hypotension. The medication must be administered slowly at a rate of no greater than 300 milligrams per minute, not by rapid infusion. The IV site should be assessed prior to the initiation of the medication to prevent complications from extravasation of the medication into the tissues. Methocarbamol is detoxified by the kidneys, not the liver. The client diagnosed with a partial thickness, burn to the entire right leg, who is being treated with silver sulfadiazine, develops leukopenia. Which medication should the nurse expect the HCP to prescribe? 1. Discontinue the silver sulfadiazine ointment immediately. 2. Continue administering the silver sulfadiazine ointment. 3. Administer aminoglycoside antibiotics intravenously. 4. Administer hydrocortisone cream to the burned area. The correct answer is 2. Continue administering the silver sulfadiazine ointment. Silver sulfadiazine is a sulfonamide antibacterial agent. Many clients develop marked leukopenia in response to silver sulfadiazine. The leukopenia will improve spontaneously over the course of treatment. Leukopenia does not contraindicate use of this medication. Leukopenia improves over the course of the treatment with silver sulfadiazine and does not warrant discontinuing the medication. Leukopenia, secondary to silver sulfadiazine therapy, does not warrant the administration of aminoglycoside antibiotics. Hydrocortisone cream does not treat leukopenia secondary to silver sulfadiazine. The client diagnosed with osteoarthritis is prescribed celecoxib. Which statement by the client warrants intervention by the nurse? 1. I take aspirin daily to help prevent heart disease. 2. I am allergic to penicillin and aminoglycosides. 3. I know I am overweight and need to lose 50 pounds. 4. I walk 30 minutes at least 3 times a week. The correct answer is 1. I take aspirin daily to help prevent heart disease. Celecoxib is an NSAID. The client should not take aspirin with an NSAID because it can increase the risk of gastrointestinal upset and possible gastrointestinal bleeding. Allergies to antibiotics are not a contraindication to the use of NSAID. Obesity is not contraindicated in clients taking NSAIDs. Exercising is recommended for clients with osteoarthritis unless it causes pain. Therefore, this activity would not warrant the client not taking celecoxib. The client is admitted to the emergency department diagnosed with a partial and full thickness burn to the left leg. Which question is most important for the nurse to ask the client? 1. When was your last tetanus shot? 2. Can you tell me how this burn happened? 3. Will you need any help when you go home? 4. Have you taken any antibiotics in the last week? The correct answer is 1. When was your last tetanus shot? A tetanus toxoid is administered intramuscularly early in the acute phase of burn care to prevent Clostridium tetani infection. If the client has not had a tetanus shot within the last 10 years, or if the time is in doubt, a booster of tetanus toxoid should be administered. The client diagnosed with severe osteoarthritis of the left knee is receiving sodium hyaluronate injected directly into the left knee. Which information should be discussed with the client? 1. Explain that this medication will cause some bleeding into the joint. 2. Instruct the client to avoid any strenuous activity for 48 hours after injection. 3. Discuss that the medication will be injected daily for 7 days. 4. Tell the client that strict bed rest is required for 24 hours after the injection. The correct answer is 2. Instruct the client to avoid any strenuous activity for 48 hours after injection. Sodium hyaluronate is a synovial joint lubricant used for relief of osteoarthritis pain unrelieved by NSAIDs. After the injection, the client can walk and perform routine daily activities, but running, bicycling, or strenuous activity should be avoided. Sodium hyaluronate is a preparation of a chemical normally found in high amounts in the synovial fluid. The injection replaces or supplements the body's natural hyaluronic acid that deteriorates as a result of the inflammation of osteoarthritis. Any bleeding into the joint is a complication. Bleeding into a joint would not be the expected benefit of any type of medication. The treatment includes 3 to 5 injections, with the client receiving 1 injection every week. This injection is done in an HCP's office. The client will be able to walk out of the clinic after the injection. The client experienced an electrical burn that resulted in full thickness burns to the right and left hand. The HCP ordered the fluid resuscitation rates. Which data indicates the fluid resuscitation is effective? 1. The client's urine output is less than 30 milliliter per hour. 2. The client's urine output is at least 50 milliliter per hour. 3. The client's urine output is 75 to 100 milliliter per hour. 4. The client's urine output is greater than 200 milliliter per hour. The correct answer is 3. The client's urine output is 75 to 100 milliliter per hour. The client diagnosed with an electrical burn should have a urine output of 75 to 100 milliliter per hour for the fluid resuscitation to be effective. An output of greater than 100 milliliter per hour would indicate the client is losing too much fluid and that the fluid resuscitation is not effective. Urine output of less than 30 milliliter per hour would not indicate the fluid resuscitation is effective. For option 2, this would indicate effective fluid resuscitation for a client diagnosed with a thermal burn, but not for a client diagnosed with an electrical burn. The nurse is preparing to administer the following medications. Which medication should the nurse question administering? 1. Ibuprofen to a client receiving furosemide. 2. Nabumetone to a client receiving digoxin. 3. Acetyl salicylic acid to a client receiving warfarin. 4. Ketorolac intramuscularly to a client on morphine. The correct answer is 3. Acetyl salicylic acid to a client receiving warfarin. Acetyl salicylic acid is a mild analgesic, but it is also an antiplatelet. Acetyl salicylic acid displaces warfarin from protein-binding sites and will increase the client's bleeding. Therefore, the nurse should question administering the acetyl salicylic acid. Ibuprofen is an NSAID. NSAIDs do not interfere with the effectiveness of loop diuretics. Therefore, the nurse would not question administering the ibuprofen. Nabumetone is a cyclooxygenase 2 inhibitor. Cyclooxygenase 2 inhibitors do not interfere with the effectiveness of cardiac glycosides. Therefore, the nurse would not question administering the nabumetone. Ketorolac is an NSAIDs. Ketorolac is often administered around the clock to a client in pain, along with a narcotic analgesic. Ketorolac decreases the inflammation to help decrease the pain. The client diagnosed with a full-thickness burn over 38% of the body is admitted to the burn unit 4 hours after the fire. The HCP writes an order for Ringer's lactate, 450 ml per hour. Which interventions should the nurse implement? Select all that apply. 1. Question the HCP's orders. 2. Administer the IV fluid as prescribed. 3. Infuse the IV fluid via a pump. 4. Do not administer more than 200 ml an hour. 5. Verify the order with another nurse in the burn unit. The correct answers are 2. Administer the IV fluid as prescribed, and 3. Infuse the IV fluid via a pump. There are formulas that are used to determine the client's fluid volume resuscitation. The formulas specify the total amount of fluid that must be infused in 24 hours, 50% in the first 8 hours, followed by the other 50% over the next 16 hours. This is a large amount of fluid, but its administration is not uncommon in clients diagnosed with full thickness, burns over more than 20% of their total body surface. The IV fluids must be infused on a pump to ensure the client receives the correct amount for fluid resuscitation. For option 1, the nurse should administer this IV fluid as ordered. For option 4, this is not an unusual amount of fluid to be infused. There is no absolute amount of fluid that a client may require during fluid resuscitation. For option 5, there is no reason to verify this order with another nurse in the burn unit. The client is taking acetyl salicylic acid 4 to 5 times a day for severe osteoarthritic pain. Which teaching interventions should the nurse discuss with the client? Select all that apply. 1. Do not drink any type of alcoholic beverages. 2. Keep the acetyl salicylic acid bottle out of the reach of children. 3. Inform the dentist about taking high doses of acetyl salicylic acid. 4. Maintain a serum salicylate level between 15 and 30 milligrams per deciliter. 5. Explain that ringing in the ears is a common side effect. The correct answers are 1. Do not drink any type of alcoholic beverages. 2. Keep the acetyl salicylic acid bottle out of the reach of children. 3. Inform the dentist about taking high doses of acetyl salicylic acid. And 4. Maintain a serum salicylate level between 15 and 30 milligrams per deciliter. Alcohol displaces warfarin from protein-binding sites and will increase the client's bleeding. Therefore, the nurse should instruct the client not to drink alcohol. Acetyl salicylic acid poisoning can kill children, and all medications, prescription or non-prescription, should be kept out of the reach of children. High doses of acetyl salicylic acid can cause bleeding. Therefore, the dentist should be made aware of the client's medication use. Aspirin toxicity can occur when the client is taking acetyl salicylic acid 4 to 5 times a day. Therefore, the serum level should be kept within normal limits. Mild toxicity occurs with serum levels above 30 milligrams per deciliter, and severe toxicity occurs above 50 milligrams per deciliter. Tinnitus is a sign of aspirin toxicity and should be reported to the HCP. The nurse is discussing the application of silver nitrate to a client diagnosed with a partial thickness burn to the left leg. Which information should the nurse teach the client when discussing how to apply this medication after discharge? 1. Administer the silver nitrate ointment directly to the burned area twice a day. 2. Notify the HCP if a black discoloration occurs on the burned area. 3. Apply the silver nitrate solution to the wound dressing every 2 hours. 4. Do not allow anyone except the HCP to change the wound dressing. The correct answer is 3. Apply the silver nitrate solution to the wound dressing every 2 hours. Silver nitrate is a topical antimicrobial. Silver nitrate is used as a 0.5% solution in distilled water and should be applied to the bulky gauze dressing every 2 hours, and the dressing should be changed twice a day. Option 1 is the incorrect way to apply silver nitrate. Silver nitrate solution causes a black discoloration on all skin surfaces and dressings with which it comes into contact. Therefore, the client would not need to notify the HCP. The bulky wound dressing must be changed twice a day. Therefore, the nurse must teach the client to change the dressing. A dressing change does not have to be done only by the HCP. The nurse in a long-term care facility is planning the care for a client with a percutaneous endoscopic gastrostomy feeding tube. Which intervention should the nurse include in the plan of care? 1. Inspect the insertion line at the nares prior to instilling formula. 2. Elevate the head of the bed after feeding the client. 3. Place the client in the Sims position following each feeding. 4. Change the dressing on the feeding tube every 3 days. The correct answer is 2. Elevate the head of the bed after feeding the client. Elevating the head of the bed uses gravity to keep the formula in the gastric cavity and help prevent it from refluxing into the esophagus, which predisposes the client to aspiration. A gastrostomy tube is placed directly into the stomach through the abdominal wall. The nares is the opening of the nostril. The Sims position is the left lateral side-lying flat position. This position is used for administering enemas and can be used to prevent aspiration in clients sedated by anesthesia. The sedated client would not have a full stomach. Dressings on PEG tubes should be changed at least daily. If there is no dressing, the insertion site is still assessed daily. The home healthcare nurse is talking on the telephone to a male client diagnosed with hypertension and hears the client sneezing. The client tells the nurse he has been blowing his nose frequently. Which question should the nurse ask the client? 1. Have you had the flu shot in the last 2 weeks? 2. Are there any small children in the home? 3. Are you taking over-the-counter medicine for these symptoms? 4. Do you have any cold sores associated with your sneezing? The correct answer is 3. Are you taking over-the-counter medicine for these symptoms? A client diagnosed with hypertension should not take many of the over-the-counter medications because they work by causing vasoconstriction, which will increase the hypertension. Influenza is a viral illness that might cause these symptoms. However, an immunization should not give the client the illness. Coming into contact with small children increases the risk of contracting colds and the flu, but the client has a problem, not just a potential one. Cold sores are actually an infection by the herpes simplex virus. Colds and cold-like symptoms are caused by the rhinovirus or influenza virus. The term cold sore is a common term that still persists in the populace. The keys to answering this question are the words hypertension and cold. Anytime a client has a chronic illness, the client should discuss over-the-counter medications with the healthcare provider or a pharmacist. Many of the routine medications for chronic illnesses interact with over-the-counter medications. The nurse is discussing the neonatal blood screening test with a new mother. The nurse knows that the teaching was successful when the mother states that the test screens for the presence in the newborn of which of the following diseases? Select all that apply. 1. Hypothyroidism. 2. Sickle cell disease. 3. Galactosemia. 4. Cerebral palsy. 5. Cystic fibrosis. The correct answers are 1. Hypothyroidism, 2. Sickle cell disease, 3. Galactosemia, and 5. Cystic fibrosis. Congenital hypothyroidism is a malfunction of or complete absence of the thyroid gland that is present from birth. It is screened for in all 50 states. Sickle cell disease is an autosomal recessive disease resulting in abnormally shaped red blood cells. It is screened for in all 50 states. Galactosemia is an incurable autosomal recessive disease characterized by the absence of the enzyme required to metabolize galactose. It is screened for in all 50 states. Cystic fibrosis is an autosomal recessive illness characterized by the presence of thick mucus in many organ systems, most notably the respiratory tract. It is screened for in all 50 states. Cerebral palsy is a disorder characterized by motor dysfunction resulting from a non-progressive injury to brain tissue. The injury may occur during pregnancy, labor, delivery, or shortly after delivery. Physical examination is required to diagnose cerebral palsy. Blood screening is not an appropriate means of diagnosis. It is important to realize that neonatal screening is state-specific. Each state determines which diseases will be screened for. In March 1915, the Advisory Committee on Heritable Disorders in Newborns and Children recommended that all newborns be screened for 32 core disorders and 26 secondary disorders. Unfortunately, many states screen for far fewer disorders. A nurse is teaching a mother how to care for her 3-day-old son's circumcised penis. Which of the following actions demonstrates that the mother has learned the information? 1. The mother cleanses the glands with a cotton swab dipped in hydrogen peroxide. 2. The mother covers the glands with antifungal ointment after rinsing off any discharge. 3. The mother squeezes soapy water from the washcloth over the glands. 4. The mother replaces the dry, sterile dressing before putting on the diaper. The correct answer is 3. The mother squeezes soapy water from the washcloth over the glands. Squeezing soapy water over the penis cleanses the area without irritating the site and causing the site to bleed. Hydrogen peroxide is not used when cleansing the circumcised penis. Antifungals are not indicated in this situation. Dry dressings are not applied to the circumcised penis. It is, however, usually recommended to liberally apply petroleum jelly to the site before diapering. The petroleum jelly may be applied directly to the penis via a sterile dressing or via a petroleum jelly-impregnated gauze. The circumcised penis has undergone a surgical procedure, but to apply a dry dressing is potentially injurious. If the dressing adheres to the newly circumcised penis, the incision could bleed. You should be aware that with routine cleaning, as cited previously, circumcisions usually heal quickly and rarely become infected. The school nurse is presenting a class to students at a primary school on how to prevent the transmission of the common cold virus. Which information should the nurse discuss? 1. Instruct the children to always keep a tissue or handkerchief with them. 2. Explain that children current with immunizations will not get a cold. 3. Tell the children they should go to the doctor if they get a cold. 4. Demonstrate to the students how to wash hands correctly. The correct answer is 4. Demonstrate to the students how to wash hands correctly. Hand washing is the single most useful technique for prevention of disease. Colds are caused by a virus, and antibiotics do not treat a virus. Therefore, there is no need to go to a healthcare provider. There is no immunization for the common cold. Colds are actually caused by at least 200 separate viruses, and the viruses mutate frequently. It is not feasible for a child to always have a tissue or handkerchief available. Option 1 contains the word always, an absolute word, and in most questions, absolutes such as always, never, and only make that answer option incorrect. Using the Neonatal Infant Pain Scale, NIPS, a nurse is assessing the pain response of a newborn who has just had a circumcision. The nurse is assessing a change in which of the following signs, symptoms. Select all that apply. 1. Heart rate. 2. Blood pressure. 3. Temperature. 4. Facial expression. 5. Breathing pattern. The correct answers are 4. Facial expression and 5. Breathing pattern. Facial expression is one variable that is evaluated as part of the NIPS. Breathing pattern is one variable that is evaluated as part of the NIPS. Although assessed in other pain scales, the heart rate is not part of the NIPS. Blood pressure is not assessed in any infant pain scale. Temperature is not assessed in any infant pain scale. You should be familiar with the pain rating scales and use them clinically because neonates cannot communicate their pain to the nurse. The scoring variables that are evaluated when assessing neonatal pain using the NIPS are facial expression, crying, breathing patterns, movement of arms and legs, and state of arousal. Other tools for assessing pain in the neonate are the Pain Assessment Tool, the Neonatal Post-Op Pain Scale, and the Premature Infant Pain Profile. Which information should the nurse teach the client diagnosed with acute sinusitis? 1. Instruct the client to complete all the ordered antibiotics. 2. Teach the client how to irrigate the nasal passages. 3. Have the client demonstrate how to blow the nose. 4. Give the client samples of a narcotic analgesic for the headache. The correct answer is 1. Instruct the client to complete all the ordered antibiotics. The client should be taught to take all antibiotics as ordered. Discontinuing antibiotics prior to the full dose results in the development of antibiotic-resistant bacteria. Sinus infections are difficult to treat and may become chronic and will then require several weeks of therapy or possibly surgery to control. If the sinuses are irrigated, it is done under anesthesia by a healthcare provider. Blowing the nose will increase pressure in the sinus cavities and will cause the client increased pain. The nurse is not licensed to prescribe medications, so this is not in the nurse's scope of practice. Also, narcotic analgesic medications are controlled substances and require written documentation of being prescribed by the healthcare provider. Samples are not generally available. Note in this situation, an all is in the correct answer. There are very few cases in which absolute adjectives will describe the correct answer. You must be aware that general rules will not always apply. A baby boy is to be circumcised by the mother's obstetrician. Which of the following actions shows that the nurse is being a patient advocate? 1. Before the procedure, the nurse prepares the sterile field for the physician. 2. The nurse refuses to unclothe the baby until the doctor orders something for pain. 3. The nurse holds the feeding immediately before the circumcision. 4. After the procedure, the nurse monitors the site for signs of bleeding. The correct answer is 2. The nurse refuses to unclothe the baby until the doctor orders something for pain. The nurse is being a patient advocate because the baby is unable to ask for pain medication. The American Academy of Pediatrics has made a policy statement that pain medications be used during all circumcision procedures. Circumcision is a surgical procedure that requires a sterile field and sterile technique. The nurse is performing safe practice in this situation. If a baby feeds immediately before the circumcision, he may aspirate his feeds. This is safe practice. Making sure the baby is not hemorrhaging at the incision site is also an example of safe nursing practice. Nurses perform a variety of roles. Being a safe practitioner is an essential role of the nurse. Just as important, and quite different, however, is the role of patient advocate, that is, providing support for the rights of a client who is unable to speak for or support himself or herself. The client has been diagnosed with chronic sinusitis. Which sign-symptom alerts the nurse to a potentially life-threatening complication? 1. Muscle weakness. 2. Purulent sputum. 3. Nuchal rigidity. 4. Intermittent loss of muscle control. The correct answer is 3. Nuchal rigidity. Nuchal rigidity is a sign-symptom of meningitis, which is a life-threatening potential complication of sinusitis resulting from the close proximity of the sinus cavities to the meninges. Intermittent loss of muscle control can be a symptom of multiple sclerosis, but it would not be a life-threatening complication of sinusitis. Muscle weakness is a sign-symptom of myalgia, but it is not a life-threatening complication of sinusitis. Purulent sputum would be a sign-symptom of a lung infection, but it is not a life-threatening complication of sinusitis. A basic knowledge of anatomy and physiology would help to answer this question. The sinuses lie in the head and surround the orbital cavity. Options 1 and 4 refer to muscle problems, so both could be ruled out as wrong. A couple is asking the nurse whether or not their son should be circumcised. On which fact should the nurse's response be based? 1. Boys should be circumcised for them to establish a positive self-image. 2. Boys should not be circumcised because there is no medical rationale for the procedure. 3. Experts from the Centers for Disease Control and Prevention argue that circumcision is desirable. 4. A statement from the American Academy of Pediatrics asserts that circumcision is optional. The correct answer is 4. A statement from the American Academy of Pediatrics asserts that circumcision is optional. The American Academy of Pediatrics, although acknowledging that there are some advantages to circumcision, states that there is not enough evidence to suggest that all baby boys be circumcised. There is no evidence that circumcision status affects a boy's self-image. No official statements have been published regarding the rationality of performing circumcisions. The CDC has made no policy statement on circumcision. The client diagnosed with tonsillitis is scheduled to have surgery in the morning. Which assessment data should the nurse notify the healthcare provider about prior to surgery? 1. The client has a hemoglobin of 12.2 grams per deciliter and hematocrit of 36.5%. 2. The client has an oral temperature of 100.2 degrees Fahrenheit and a dry cough. 3. There are 1 to 2 white blood cells in the urinalysis. 4. The client's current international normalized ratio is 1.0. The correct answer is 2. The client has an oral temperature of 100.2 degrees Fahrenheit and a dry cough. A low-grade temperature and a cough could indicate the presence of an infection, in which case the healthcare provider would not want to subject the client to anesthesia and the possibility of further complications. The surgery would be postponed. The hemoglobin and hematocrit given are within normal range. This would not warrant notifying the healthcare provider. 1 to 2 WBCs in a urinalysis is not uncommon because of the normal flora in the bladder. The INR indicates that the client's bleeding time is within normal range. In this question, all the answer options contain normal data except for one. The nurse would not call the healthcare provider to notify him or her of normal values. A nurse notes that a 6-hour-old neonate has cyanotic hands and feet. Which of the following actions by the nurse is appropriate? 1. Place the child in an isolette. 2. Administer oxygen. 3. Swaddle the baby in a blanket. 4. Apply pulse oximeter. The correct answer is 3. Swaddle the baby in a blanket. The baby's extremities are cyanotic as a result of the baby's immature circulatory system. Swaddling helps to warm the baby's hands and feet. There is no evidence in the stem that would warrant placing the child in an isolette. Cyanotic hands and feet are not signs of hypoxia in the neonate. There is no evidence in the stem that would warrant monitoring with the pulse oximeter. You must be familiar with the differences between normal findings of the newborn and those of an older child or adult. Acrocyanosis, which is bluish cyanotic hands and feet, is normal in the very young neonate resulting from his or her immature circulation to the extremities. The influenza vaccine is in short supply. Which group of clients would the public health nurse consider priority when administering the vaccine? 1. Elderly and chronically ill clients. 2. Childcare workers and children less than 4 years of age. 3. Hospital chaplains and healthcare workers. 4. School teachers and students living in a dormitory. The correct answer is 1. Elderly and chronically ill clients. The elderly and chronically ill are at greatest risk for developing serious complications if they contract the influenza virus. It is recommended people in contact with children receive the flu vaccine whenever possible, but these clients should be able to withstand a bout with the flu if their immune systems are functioning normally. It is probable these clients will be exposed to the virus, but they are not as likely to develop severe complications with intact functioning immune systems. During flu season, the more people the individual comes into contact with, the greater the risk the client will be exposed to the influenza virus, but this group of people would not receive the vaccine before the elderly and chronically ill. Sometimes, you may think the answer is too easy and obvious, but you should not try to second-guess the question. Test writers are not trying to trick you, they are trying to evaluate knowledge. A nurse is doing a newborn assessment on a new admission to the nursery. Which of the following actions should the nurse make when evaluating the baby for developmental dysplasia of the hip? Select all that apply. 1. Grasp the baby's legs with the thumbs on the inner thighs and forefingers on the outer thighs. 2. Gently adduct and abduct the baby's thighs. 3. Palpate the trochanter during hip rotation. 4. Place the baby in a fetal position. 5. Compare the lengths of the baby's legs. The correct answers are 1. Grasp the baby's legs with the thumbs on the inner thighs and forefingers on the outer thighs. 2. Gently adduct and abduct the baby's thighs. 3. Palpate the trochanter during hip rotation. And 5. Compare the lengths of the baby's legs. With the baby placed flat on its back, the practitioner grasps the baby's thighs using his or her thumbs and index fingers. When assessing for Ortolani sign, the baby's thighs are abducted. When performing the Barlow test, the baby's thighs are adducted. With the baby's hips and knees at 90-degree angles, the hips are abducted. With developmental dysplasia of the hip, the trochanter dislocates from the acetabulum. The nurse would feel the dislocation while palpating the trochanter. Legs are extended to assess for equal leg lengths and for equal thigh and gluteal folds. When performing both the Ortolani and Barlow tests, the baby is placed flat on his or her back. When assessing for symmetry of leg lengths and tissue folds, the baby is placed in both the supine and prone positions. The order of the steps of the Ortolani procedure is 1. The nurse places the baby on the baby's back. 2. The nurse grasps the baby's thighs with a thumb on the inner aspect and forefingers over the trochanter. 3. With the knees flexed at 90-degree angles, the hips are abducted. And 4. The nurse palpates the trochanter to assess for hip laxity. The Barlow test is performed by 1. Adducting the baby's legs. 2. Gently pushing the legs posteriorly. And 3. Feeling to note any slippage of the trochanter out of the acetabulum. Galeazzi sign, to assess for uneven knee heights, can also be performed. The client diagnosed with chronic sinusitis who has undergone a Caldwell-Luke procedure is complaining of pain. Which intervention should the nurse implement first? 1. Administer the narcotic analgesic IVP. 2. Perform gentle oral hygiene. 3. Place the client in semi-Fowler's position. 4. Assess the client's pain. The correct answer is 4. Assess the client's pain. Prior to intervening, the nurse must assess to determine the amount of pain and possible complications occurring that could be masked if narcotic medication is administered. The client has complained of pain, and the nurse, after determining the severity of the pain and barring any complications in the client, will administer pain medication after completion of the assessment. Oral hygiene helps to prevent the development of infections and promotes comfort, but it will not relieve the pain. Placing the client in the semi-Fowler's position will reduce edema of inflamed sinus tissue, but it will not immediately affect the client's perception of pain. Whenever there is an assessment answer among the answer options, you should look carefully at what is being assessed. If the option says to assess the problem identified in the question, it will usually be the correct answer. Remember, the first step in the nursing process is assessment. The pediatrician has ordered vitamin K0, 0.5 milligrams IM for a newborn. The medication is available as 2 milligrams per milliliters. How many milliliters should the nurse administer to the baby? Calculate to the nearest hundredth. To solve this problem, you set up the formula as 2 milligrams over 1 milliliters equals to 0.5 milligrams over x. You cross-multiply 2 times x and 0.5 times 1. You get 2x equals to 0.5. You divide 2 on both sides, and you get x equals to 0.25 milliliters. This is the amount that the nurse should administer for each dose. The charge nurse on a surgical floor is making assignments. Which client should be assigned to the most experienced nurse? 1. The 36-year-old client who has undergone an antral irrigation for sinusitis yesterday and has moderate pain. 2. The 6-year-old client scheduled for a tonsillectomy and adenoidectomy this morning who will not swallow medication. 3. The 18-year-old client who had a Caldwell-Luke procedure 3 days ago and has purulent drainage on the drip pad. 4. The 45-year-old client diagnosed with a peritonsillar abscess who requires IVPB antibiotic therapy 4 times a day. The correct answer is 3. The 18-year-old client who had a Caldwell-Luke procedure 3 days ago and has purulent drainage on the drip pad. The post-operative client with purulent drainage could be developing an infection. The experienced nurse would be needed to assess and monitor the client's condition. Any nurse who is capable of administering IV/PB medications can care for this client. This client is 1 day post-operative and has moderate pain, which is to be expected after surgery. A less experienced nurse can care for this client. A child about to go to surgery involving the throat area can be expected to have painful swallowing. This does not require the most experienced nurse. In this type of question, you must determine if the situation described is expected or within normal limits. The option that gives unexpected data or data not within normal limits requires a nurse with more knowledge and experience. 4 newborns are in the neonatal nursery, none of whom is crying or in distress. Which of the babies should the nurse report to the neonatologist? 1. 16-hour-old baby who has yet to pass meconium. 2. 16-hour-old baby whose blood glucose is 50 milligrams per deciliter. 3. 2-day-old baby who is breathing irregularly at 70 breaths per minute. 4. 2-day-old baby who is excreting a milky discharge from both nipples. The correct answer is 3. 2-day-old baby who is breathing irregularly at 70 breaths per minute. Normal neonatal breathing is 30 to 60 breaths per minute. This baby is tachypneic. Meconium should pass within 24 hours of delivery. This baby's glucose level is within normal limits. A milky discharge, which is milk, is normal. It results from the drop in maternal hormones in the neonatal system following delivery. The client diagnosed with influenza A is being discharged from the emergency department with a prescription for antibiotics. Which statement by the client indicates an understanding of this prescription? 1. These pills will make me feel better fast, and I can return to work. 2. The antibiotics will help prevent me from developing a bacterial pneumonia. 3. If I had gotten this prescription sooner, I could have prevented this illness. 4. I need to take these pills until I feel better, then I can stop taking the rest. The correct answer is 2. The antibiotics will help prevent me from developing a bacterial pneumonia. Secondary bacterial infections often accompany influenza, and antibiotics are often prescribed to help prevent the development of a bacterial infection. Antibiotics will not prevent the flu. Only the flu vaccine will prevent the flu. When people take portions of the antibiotic prescription and stop taking the remainder, an antibiotic-resistant strain of bacteria may develop, and the client may experience a return of symptoms. But this time, the antibiotics will not be effective. A person with a viral infection should not return to work until the virus has run its course, because the antibiotics help prevent complications of the virus, but they do not make the client feel better faster. A 2-day-old breastfeeding baby born via normal spontaneous vaginal delivery has just been weighed in the newborn nursery. The nurse determines that the baby has lost 3.5% of the birth weight. Which of the following nursing actions is appropriate? 1. Do nothing because this is a normal weight loss. 2. Notify the neonatologist of the significant weight loss. 3. Advise the mother to bottle feed the baby at the next feed. 4. Assess the baby for hypoglycemia with a glucose monitor. The correct answer is 1. Do nothing because this is a normal weight loss. The baby has lost less than 4% of its birth weight. Babies often lose between 5% and 10% of their birth weight. A loss greater than 10% is considered pathological. Supplementation is not needed at this time. There is no indication in the stem that the baby is at high risk for hypoglycemia. The nurse is developing a plan of care for a client diagnosed with laryngitis and identifies the client problem, altered communication. Which intervention should the nurse implement? 1. Instruct the client to drink a mixture of brandy and honey several times a day. 2. Encourage the client to whisper instead of trying to speak at a normal level. 3. Provide the client with a blank notepad for writing any communication. 4. Explain that the client's aphonia may become a permanent condition. The correct answer is 3. Provide the client with a blank notepad for writing any communication. Voice rest is encouraged for the client experiencing laryngitis. Aphonia, or inability to speak, is a temporary condition associated with laryngitis. The client with laryngitis is instructed to avoid all alcohol. Alcohol causes increased irritation of the throat. Whispering places added strain on the larynx. Encouraging the use of alcohol, with the exception of a glass of red wine, is not accepted medical practice. Therefore, option 1 could be eliminated. Option 4 has an absolute, permanent, in it and therefore could be eliminated from consideration. A mother, 1 day postpartum from a 3-hour labor and a spontaneous vaginal delivery, questions the nurse because her baby's face is purple. Upon examination, the nurse notes petechiae over the scalp, forehead, and cheeks of the baby. The nurse's response should be based on which of the following? 1. Petechiae are indicative of severe bacterial infections. 2. Rapid deliveries can injure the neonatal presenting part. 3. Petechiae are characteristic of the normal newborn rash. 4. The injuries are a sign that the child has been abused. The correct answer is 2. Rapid deliveries can injure the neonatal presenting part. When neonates speed through the birth canal during rapid deliveries, the presenting parts become bruised. The bruising often takes the form of petechial hemorrhages. Petechiae can be present as a result of an infectious disease, for example, meningococemia. In this situation, however, there is no indication that an infection is present. Erythema toxicum, the newborn rash, is characterized by papules or pustules on an erythematous base. There is nothing in the scenario to suggest that child abuse has occurred. Although this question is about the neonate, the key to answering the question is knowledge of the normal length of a vaginal labor and delivery. Multiparous labors average about 8 to 10 hours, and primiparous labors can last more than 20 hours. The 3-hour labor noted in the stem of the question is significantly shorter than the average labor. The neonate, therefore, has progressed rapidly through the birth canal and, as a result, is bruised. Which task is most appropriate for the nurse to delegate to an unlicensed assistive personnel? 1. Feed a client who is post-operative tonsillectomy the first meal of clear liquids. 2. Encourage the client diagnosed with a cold to drink a glass of orange juice. 3. Obtain a throat culture on a client diagnosed with bacterial pharyngitis. 4. Escort the client diagnosed with laryngitis outside to smoke a cigarette. The correct answer is 2. Encourage the client diagnosed with a cold to drink a glass of orange juice. Clients with colds are encouraged to drink 2,000 milliliters of liquids a day. The UAP could do this. Tonsillectomies cause throat edema and difficulty swallowing. The nurse must observe the client's ability to swallow before this task can be delegated. Throat swabs for culture must be done correctly, or false negative results can occur. The nurse should obtain the swab. Clients with laryngitis are instructed not to smoke. Smoking is discouraged in all healthcare facilities. Sending nursing personnel outside encourages an unhealthy practice, which is not the best use of the personnel. Interventions requiring assessment, teaching, and evaluation cannot be delegated. Levels of activities being delegated should be appropriate for the level of training of the staff member carrying out the task. Tasks delegated must conform to safe healthcare practice. A mother asks the nurse to tell her about the responsiveness of neonates at birth. Which of the following answers is appropriate? Select all that apply. 1. Babies have a poorly developed sense of smell until they are 2 months old. 2. Babies respond to all forms of taste well, but they prefer to eat sweet things like breast milk. 3. Babies are especially sensitive to being touched and cuddled. 4. Babies are nearsighted with blurry vision until they are about 3 months of age. 5. Babies respond to many sounds, especially to the high-pitched tone of the female voice. The correct answers are 2. Babies respond to all forms of taste well, but they prefer to eat sweet things like breast milk. 3. Babies are especially sensitive to being touched and cuddled. And 5. Babies respond to many sounds, especially to the high-pitched tone of the female voice. Babies respond to all forms of taste. They prefer sweet things. Babies' sense of touch is considered to be the most well-developed sense. Babies hear quite well once the amniotic fluid is absorbed from the ear canal. All newborns' hearing is tested prior to discharge from the newborn nursery. If a baby is found to be hearing impaired, the baby should receive early intervention. All of the baby's senses are well developed at birth. Babies see quite well at 8 to 12 inches. They prefer to look at the human face. The nurse is caring for a client diagnosed with a cold. Which is an example of an alternative therapy? 1. Vitamin C, 2,000 milligrams daily. 2. Strict bed rest. 3. Humidification of the air. 4. Decongestant therapy. The correct answer is 1. Vitamin C, 2,000 milligrams daily. Alternative therapies are therapies not accepted as standard medical practice. These may be encouraged as long as they do not interfere with the medical regimen. Vitamin C in large doses is thought to improve the immune system's functions. Bed rest is accepted standard advice for a client with a cold. Humidifying the air helps to relieve congestion and is a standard practice. Decongestant therapy is standard therapy for a cold. Only one of the answer options is not common advice for a client with a cold. When all options but one match each other, then the odd option should be selected as the correct answer. To reduce the risk of hypoglycemia in a full-term newborn weighing 2,900 grams, what should the nurse do? 1. Maintain the infant's temperature above 97.7 degrees Fahrenheit / 36.5 degrees Celsius. 2. Feed the infant glucose water every 3 hours until breastfeeding well. 3. Assess blood glucose levels every 3 hours for the first 12 hours. 4. Encourage the mother to breastfeed every 4 hours. The correct answer is 1. Maintain the infant's temperature above 97.7 degrees Fahrenheit / 36.5 degrees Celsius. Hypothermia in the neonate is defined as a temperature below 97.7 degrees Fahrenheit. Cold stress syndrome may develop if the baby's temperature is below that level. A healthy neonate does not need supplemental feedings, and if supplements are needed, they should be either formula or breast milk. There is no indication in the STEM that glucose assessments are needed for this baby. Babies should be breastfed every 2 to 3 hours. Feedings every 4 hours are not frequent enough. It is important for the student to know that a baby weighing 2,900 grams is an average-sized baby. They range 2,500 to 4,000 grams. In addition, because no other information is included in the STEM, you must assume that the baby is healthy. The answers, therefore, should be evaluated in terms of the healthy newborn. Hypoglycemia can result when a baby develops cold stress syndrome because babies must metabolize food to create heat. When they use up their food stores, they become hypoglycemic. The nurse is assessing a 79-year-old client diagnosed with pneumonia. Which signs and symptoms should the nurse expect to assess in the client? 1. Confusion and lethargy. 2. High fever and chills. 3. Frothy sputum and edema. 4. Bradypnea and jugular vein distension. The correct answer is 1. Confusion and lethargy. The elderly client diagnosed with pneumonia may present with weakness, fatigue, lethargy, confusion, and poor appetite, but not have any of the classic signs and symptoms of pneumonia. Fever and chills are classic symptoms of pneumonia, but they are usually absent in the elderly client. Frothy sputum and edema are signs and symptoms of heart failure, not pneumonia. The client has tachypnea, not bradypnea, and jugular vein distension accompanies heart failure. A full-term newborn was just born. Which nursing intervention is important for the nurse to perform first? 1. Remove wet blankets. 2. Assess APGAR score. 3. Insert eye prophylaxis. 4. Elicit the Moro reflex. The correct answer is 1. Remove wet blankets. When newborns are wet, they can become hypothermic from heat loss resulting from evaporation. They may then develop cold stress syndrome. The first APGAR score is not done until 60 seconds after delivery. The wet blankets should have been removed from the baby well before that time. Eye prophylaxis can be delayed until after the parents have begun bonding with their baby. Although the baby's central nervous system must be carefully assessed, reflex assessment should be postponed until after the baby is dried and is breathing on his or her own. This is a prioritizing question. Every one of the actions will be performed after the birth of the baby. The nurse must know which action is performed first. Because hypothermia can compromise a neonate's transition to extrauterine life, it is essential to dry the baby immediately to minimize heat loss through evaporation. It is important for you to review cold stress syndrome. The nurse is planning the care of a client diagnosed with pneumonia and writes a problem of impaired gas exchange. Which is an expected outcome for this problem? 1. Performs chest physiotherapy 3 times a day. 2. Able to complete activities of daily living. 3. Ambulates in the hall several times during each shift. 4. Alert and oriented to person, place, time, and events. The correct answer is 4. Alert and oriented to person, place, time, and events. Impaired gas exchange results in hypoxia, the earliest sign-symptom of which is a change in the level of consciousness. Clients do not perform chest physiotherapy. This is normally done by the respiratory therapist. Option 1 is a staff goal, not a client goal. Option 2 would be a goal for self-care deficit, but not for impaired gas exchange. Option 3 would be a goal for the problem of activity intolerance. You should match the answer option to the listed nursing problem. When writing goals for the client, it is important to remember they are written in terms of what is expected of the client. The nursery nurse is careful to wear gloves when admitting neonates into the nursery. Which of the following is the scientific rationale for this action? 1. Meconium is filled with enteric bacteria. 2. Amniotic fluid may contain harmful viruses. 3. The high alkalinity of fetal urine is caustic to the skin. 4. The baby is at high risk for infection and must be protected. The correct answer is 2. Amniotic fluid may contain harmful viruses. Amniotic fluid is a reservoir for viral diseases like HIV and hepatitis B. If the woman is infected with those viruses, the amniotic fluid will be infectious. Meconium is a sterile stool. The newborn will not produce gastrointestinal bacteria until a few days after delivery. Fetal urine is not highly alkaline. Although babies are at high risk for infection, there is no need for nurses to wear gloves routinely when caring for the babies. Immediately after delivery, the nurse is protecting himself or herself from the baby, not the other way around. By wearing gloves, the nurse is practicing standard precautions per the Centers for Disease Control and Prevention to protect himself or herself from viruses that may be present in the amniotic fluid and on the neonate's body. This question illustrates how important it is for you to read each possible answer very carefully. For example, you may be tempted to choose choice 1, but the fact that the option states that meconium contains enteric bacteria makes that answer incorrect. The nurse receives a call from the parent of a 10-month-old who has vomited 3 times in the past 8 hours. The parent describes the baby as playful and wanting to drink. The parent asks the nurse what to give the child. Select the nurse's best response. 1. Replace the next feeding with regular water and see if that is better tolerated. 2. Do not allow your baby to eat any solids. Give half the normal formula feeding and see if that is better tolerated. 3. Do not let your baby eat or drink anything for 24 hours to give the stomach a chance to rest. 4. Give your child 0.5 ounce of Pedialyte every 10 minutes. If vomiting continues, wait an hour and then repeat what you previously gave. The correct answer is 4. Give your child 0.5 ounce of Pedialyte every 10 minutes. If vomiting continues, wait an hour and then repeat what you previously gave. Offering small amounts of clear liquids is usually well tolerated. If the child vomits, make them NPO for an hour to allow the stomach to rest and then restart fluids. The child in this scenario is described as playful and therefore does not appear to be at risk for dehydration. Free water should not be given because it does not contain any electrolytes and can lead to critical electrolyte imbalances. Formula should be avoided, and clear liquids such as Pedialyte should be offered. 24 hours is too long for the infant to remain NPO. The infant needs to drink a rehydration solution, such as Pedialyte, in order to avoid severe dehydration. You should eliminate answers 1 and 3 because they could cause harm to the infant. The nurse is caring for a 3-month-old being evaluated for possible Hirschsprung disease. His parents call the nurse and show her his diaper containing a large amount of mucus and bloody diarrhea. The nurse notes that the infant is irritable and his abdomen appears very distended. Which should be the nurse's next action? 1. Reassure the parents that this is an expected finding and not uncommon. 2. Call a code for a potential cardiac arrest and stay with the infant. 3. Immediately obtain all vital signs with a quick head-to-toe assessment. 4. Obtain a stool sample for occult blood. The correct answer is 3. Immediately obtain all vital signs with a quick head-to-toe assessment. All vital signs need to be evaluated because the child with enterocolitis can quickly progress to a state of shock. A quick head-to-toe assessment will allow the nurse to evaluate the child's circulatory system. All cases of bloody diarrhea need to be evaluated because this may be a sign of enterocolitis, which is a potentially fatal complication of Hirschsprung disease. For option 2, although this is a potentially critical complication, calling a code is not necessary at this time because the infant is irritable and not unconscious. It is not a priority to test the stool for occult blood because there is obvious blood in the sample. You should select answer 3 because there is not enough information to determine the status of the child. Obtaining vital signs will help the nurse to assess the situation. The parent of a newborn asks, "Will my baby spit out the formula if it is too hot or too cold?" Which is the nurse's best response? 1. Babies have a tendency to reject hot fluids, but not cold fluids, which could result in abdominal discomfort. 2. Babies have a tendency to reject cold fluids, but not hot fluids, which could result in esophageal burns. 3. Your baby would most likely spit out formula that was too hot, but your baby could swallow some of it, which could result in a burn. 4. Your baby is too young to be physically capable of spitting out fluids and will automatically swallow anything. The correct answer is 4. Your baby is too young to be physically capable of spitting out fluids and will automatically swallow anything. Swallowing is a reflex in neonates. Infants younger than 6 weeks cannot voluntarily control swallowing. The infant is not capable of selectively rejecting fluid because swallowing is a reflex until 6 weeks. You should eliminate answers 1, 2, and 3 because they suggest that the infant is capable of selectively rejecting fluids. The nurse is caring for an infant newly diagnosed with Hirschsprung disease. What does the nurse understand about this infant's condition? Select all that apply. 1. There is a lack of peristalsis in the large intestine and an accumulation of bowel contents, leading to abdominal distension. 2. There is excessive peristalsis throughout the intestine, resulting in abdominal distension. 3. There is a small bowel obstruction, leading to ribbon-like stools. 4. There is inflammation throughout the large intestine, leading to accumulation of intestinal contents and abdominal distension. 5. There is an accumulation of bowel contents, leading to non-passage of stools. The correct answers are 1. There is a lack of peristalsis in the large intestine and an accumulation of bowel contents, leading to abdominal distension, and 5. There is an accumulation of bowel contents, leading to non-passage of stools. In Hirschsprung disease, a portion of the large intestine has an area lacking in ganglion cells. This results in a lack of peristalsis, as well as an accumulation of bowel contents and abdominal distension. There is accumulation of stool above the aganglionic bowel, which does not allow stool to pass through. There is a lack of peristalsis at the aganglionic section of the bowel. Hirschsprung disease does not include a small bowel obstruction. Hirschsprung disease does not present with inflammation throughout the large intestine. The mother of a newborn asks the nurse why the infant has to nurse so frequently. Which is the best response? 1. Formula tends to be more calorically dense, and formula-fed babies require fewer feedings than breastfed babies. 2. The newborn's stomach capacity is small, and peristalsis is slow. 3. The newborn's stomach capacity is small, and peristalsis is more rapid than in older children. 4. Breastfed babies tend to take longer to complete a feeding than formula-fed babies. The correct answer is 3. The newborn's stomach capacity is small, and peristalsis is more rapid than in older children. The small stomach capacity and rapid movement of fluid through the digestive system account for the need for small, frequent feedings. The caloric content of breast milk and formula tends to be similar. Peristalsis in infants is greater than in older children. Breastfed babies and formula-fed babies do not necessarily have a difference in feeding time. You should eliminate answers 1 and 4 because they both form generalizations that are not supported by current literature. The nurse is caring for an infant diagnosed with Hirschsprung disease. The mother states she is pregnant with a boy and wants to know if her new baby will likely have the disorder. Which is the nurse's best response? 1. Genetics play a small role in Hirschsprung disease, so there is a chance the baby will develop it as well. 2. There is no evidence to support a genetic link, so it is very unlikely the baby will also have it. 3. It is rarely seen in boys, so it is not likely your new baby will have Hirschsprung disease. 4. Hirschsprung disease is seen only in girls, so your new baby will not be at risk. The correct answer is 1. Genetics play a small role in Hirschsprung disease, so there is a chance the baby will develop it as well. There is a genetic component to Hirschsprung disease, so any future siblings are also at risk. Hirschsprung disease is seen in both males and females, but is more common in males. You can eliminate answers 3 and 4 because they are similar and therefore would not likely be the correct answer. A 4-month-old has had vomiting and diarrhea for 24 hours. The infant is fussy, and the anterior fontanelle is sunken. The nurse notes the infant does not produce tears when crying. Which task will help confirm the diagnosis of dehydration? 1. Urinalysis obtained by bagged specimen. 2. Urinalysis obtained by sterile catheterization. 3. Analysis of serum electrolytes. 4. Analysis of cerebrospinal fluid. The correct answer is 3. Analysis of serum electrolytes. The analysis of serum electrolytes offers the most information and assists with the diagnosis of dehydration. The information obtained from a urinalysis of an infant is not as helpful as serum electrolytes. The infant has limited ability to concentrate urine, so the specific gravity is not usually affected. A urinalysis does not need to be obtained by catheterization. Although critical in diagnosing meningitis, a lumbar puncture and analysis of cerebrospinal fluid are not done to confirm dehydration. Infants have limited ability to concentrate urine, so answers 1 and 2 can be eliminated immediately. The parent of a 5-year-old states that the child has been having diarrhea for 24 hours, vomited twice 2 hours ago, and now claims to be thirsty. The parent asks what to offer the child because the child is refusing Pedialyte. Which is the nurse's most appropriate response? 1. You can offer clear diet soda such as Sprite and ginger ale. 2. Pedialyte is really the best thing for your child, who, if thirsty enough, will eventually drink it. 3. Pedialyte is really the best thing for your child. Allow your child some choice in the way to take it by offering small amounts in a spoon, medicine cup, or syringe. 4. It really does not matter what your child drinks as long as it is kept down. Try offering small amounts of fluids in medicine cups. The correct answer is 3. Pedialyte is really the best thing for your child. Allow your child some choice in the way to take it by offering small amounts in a spoon, medicine cup, or syringe. Pedialyte is the first choice, as recommended by the American Academy of Pediatrics. Offering the child appropriate choices may allow the child to feel empowered and less likely to refuse the Pedialyte. Small, frequent amounts are usually better tolerated. When Pedialyte is not tolerated, it is usually recommended that clear sodas and juices be diluted. Diet beverages are not recommended because the sugar is needed to help the sodium be reabsorbed. Pedialyte is the best choice. If the child is not encouraged to drink Pedialyte, the child may become severely dehydrated. Other ways to encourage oral rehydration need to be considered. Offering small amounts of liquids is important. The type of beverage does matter because many fluids may increase vomiting and diarrhea. You should eliminate answer 2 because it offers an ultimatum to a child. The child is likely to refuse the Pedialyte, worsening the state of dehydration. Which instructions for a child diagnosed with encopresis should the nurse question? Select all that apply. 1. Limit the intake of milk. 2. Offer a diet high in protein. 3. Obtain a complete dietary log. 4. Follow up with a child psychologist. 5. After dinner, have the child sit on the toilet for 10 minutes. The correct answers are 2. Offer a diet high in protein, and 4. Follow up with a child psychologist. A diet high in protein will cause more constipation. The child and family would not be encouraged initially to seek counseling unless a psychological component to the encopresis had been identified. Dairy products are limited because they can lead to constipation. A complete dietary log should be kept to correlate the foods that lead to constipation. Children with constipation/encopresis are advised to sit on the toilet for 10 minutes after dinner to take advantage of the gastrocolic reflex. A 4-month-old is brought to the emergency department with severe dehydration. The heart rate is 198 and her blood pressure is 68/38. The infant's anterior fontanelle is sunken. The nurse notes that the infant does not cry when the intravenous line is inserted. The child's parents state that she has not held anything down in 18 hours. The nurse obtains a fingerstick blood sugar of 94. Which would the nurse expect to do immediately? 1. Administer a bolus of normal saline. 2. Administer a bolus of D10W. 3. Administer a bolus of normal saline with 5% dextrose added to the solution. 4. Offer the child an oral rehydrating solution, such as Pedialyte. The correct answer is 1. Administer a bolus of normal saline. Dehydration is corrected with the administration of an isotonic solution, such as normal saline or lactated ringer solution. Solutions containing dextrose should never be administered in bolus form because they may result in cerebral edema. Severe dehydration is not usually corrected with oral solutions. Children with altered levels of consciousness should be kept NPO. You should immediately eliminate answers 2 and 3 because they both suggest administering glucose in bolus form, which is always contraindicated in pediatric clients. Answer 4 should be eliminated because the infant is severely dehydrated and not responding to painful stimulation, which is suggested by the lack of a cry on intravenous insertion. A child is diagnosed with chronic constipation that has been unresponsive to dietary and activity changes. Which pharmacological measure is most appropriate? 1. Natural supplements and herbs. 2. Stimulant laxative. 3. Osmotic agent. 4. Pharmacological measures are not used in pediatric constipation. The correct answer is 3. Osmotic agent. A stool softener is the drug of choice because it will lead to easier evacuation. Natural supplements and herbs are not recommended because the safety and efficacy are not standardized. A stimulant laxative is not the drug of choice because it may increase abdominal discomfort and may lead to dependency. Although diet and activity modification are tried first, medications are sometimes needed. You should eliminate answer 4 because it implies that medications are never given to the constipated child. In healthcare, there are very few cases of never and always. Which child can be discharged without further evaluation? 1. A 2-year-old who has had 24 hours of watery diarrhea that has changed to bloody diarrhea in the past 12 hours. 2. A 3-year-old who had a relapse of 1 diarrhea episode after restarting a normal diet. 3. A 6-year-old who has been having vomiting and diarrhea for 2 days and has decreased urine output. 4. A 10-year-old who has just returned from a scout camping trip and has had several episodes of diarrhea. The correct answer is 2. A 3-year-old who had a relapse of 1 diarrhea episode after restarting a normal diet. It is common for children to have a relapse of diarrhea after resuming a regular diet. Diarrhea containing blood needs further evaluation to determine the source of the blood, and the child's blood counts and electrolyte balance need to be tested. Children who have had vomiting and diarrhea for more than 2 days require evaluation to determine whether IV rehydration and hospital admission are necessary. Diarrhea following a camping trip needs further evaluation because it may be caused by bacteria or parasites. You should eliminate answers 1 and 3 because they describe children who may have altered electrolytes and blood counts due to prolonged diarrhea. The nurse is caring for a 2-year-old child who was admitted to the pediatric unit for moderate dehydration due to vomiting and diarrhea. The child is restless with periods of irritability. The child is a febrile with a heart rate of 148 and a blood pressure of 90/42. Baseline laboratory tests reveal the following: sodium 152, chloride 119, and glucose 115. The parents state that the child has not urinated in 12 hours. After establishing a saline lock, the nurse reviews the physician's orders. Which order should the nurse question? 1. Administer a saline bolus of 10 milliliters per kilogram, which may be repeated if the child does not urinate. 2. Recheck serum electrolytes in 12 hours. 3. After the saline bolus, begin maintenance fluids of D5/1/4 normal saline with 10 milliequivalents potassium chloride per liter. 4. Give clear liquid diet as tolerated. The correct answer is 3. After the saline bolus, begin maintenance fluids of D5/1/4 normal saline with 10 milliequivalents potassium chloride per liter. Potassium is contraindicated because the child has not yet urinated. Potassium is not added to the maintenance fluid until kidney function has been verified. The child with dehydration secondary to vomiting and diarrhea is placed on a clear liquid diet. Fluid boluses of normal saline are administered according to the child's body weight. It is not unusual to have to repeat the bolus multiple times in order to see an improvement in the child's condition. It is important to monitor serum electrolytes frequently in the dehydrated child. The parents of a 4-year-old ask the nurse how to manage their child's constipation. Select the nurse's best response. 1. Add 2 ounces of apple or pear juice to the child's diet. 2. Be sure your child eats a lot of fresh fruit such as apples and bananas. 3. Encourage your child to drink more fluids. 4. Decrease bulky foods such as whole grain breads and brown rice. The correct answer is 3. Encourage your child to drink more fluids. Increasing fluid consumption helps to decrease the hardness of the stool. Whole grain bread and brown rice are high in fiber and help decrease constipation. 2 ounces of apple juice is most likely not a sufficient quantity to alter a 4-year-old child's bowel movements. Although fresh fruits help decrease constipation, option 3 is the better answer choice than option 2. Answer 1 decreases constipation in an infant, but not in a preschooler. The nurse is caring for a 9-month-old with diarrhea secondary to rotavirus. The child has not vomited and is mildly dehydrated, which is likely to be included in the discharge teaching. 1. Administer loperamide as needed. 2. Administer bismuth subsalicylate as needed. 3. Continue breastfeeding per routine. 4. The infant may return to day care 24 hours after antibiotics have been started. The correct answer is 3. Continue breastfeeding per routine. Breastfeeding is usually well tolerated and helps prevent death of intestinal villi and malabsorption. Antibiotics are not effective in viruses. Children should not return to daycare while they are still having diarrhea. Loperamide slows intestinal motility and allows overgrowth of organisms and should therefore be avoided. Bismuth subsalicylate slows intestinal motility and allows overgrowth of organisms and should therefore be avoided. You can eliminate answer 4 because antibiotics are not effective with viruses such as rotavirus. Answers 1 and 2 can be eliminated because antidiarrheal agents are not recommended in the pediatric population.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.